Good morning. In this video, I will briefly discuss the minimally invasive surgical procedure for the removal of the bony protrusion on the posterior surface of the heel, which can in some cases cause significant pain due to the constant rubbing against the Achilles tendon, which is then compressed between the shoe and the bony protrusion. The surgery can be performed either with a skin incision of several centimeters or minimally invasively using small skin incisions only 5 millimeters long. The final outcome of each procedure is essentially the same, but the minimally invasive approach generally allows for a quicker recovery. There are obviously some cases where an invasive approach is more appropriate, and these are cases where the Achilles tendon is severely affected. In these cases, the minimally invasive approach may not be sufficient. Therefore, I encourage you to discuss your specific case with your surgeon, who will certainly be able to best advise you. The procedure is performed with the patient lying on their back or stomach and involves 2 small skin incisions on the back of the ankle. A 4 millimeters diameter camera is passed through these incisions. This camera is connected to a high-resolution monitor that allows the images transmitted via optical fibers to be viewed. Through the second cut of the skin, we use tools that we use to clean the fatty tissue first and then the bone tissue. At this point, you can see a radio frequency instrument burning the soft tissue, allowing us to have a good view to move on to the second and final phase of the procedure, which is when we remove the bony protrusion using a type of motorized razor with an oscillating blade that allows us to file down the bony protrusion layer by layer using repeated wave-like movements. Finally, we check that the bone surface is smooth and free of irregularities, as you can see here. The next step is to file away any protruding bone debris. At the end of the procedure, we close the skin incisions with absorbable sutures, which will therefore fall out on their own after a few weeks, and apply a sterile dressing and an elastic bandage. You can bear full weight on the floor, provided you use a long boot splint for the next 3 weeks. Hospitalization usually lasts 1 or 2 days. To reduce the risk of deep vein thrombosis, it is advisable to have a daily injection under the skin using low molecular weight heparin, at least until you are able to put full weight on the operated foot comfortably and without limping. I will now list the common risks and complications associated with this type of surgical technique, which should be discussed specifically with your surgeon. If you think this video was helpful, or if you think it could be useful to someone else, please like and subscribe to the channel. Thank you.